I will take appropriate BSI precautions. I will determine if the scene is safe to enter. I will determine the mechanism of injury by observation. I will determine the number of patients. I will determine the need for additional resources. And I will take direct appropriate spinal precautions, if indicated. Hello, my name is Destiny. I'm an EMR. May I help you?
Yes.
Okay, what is your name?
Bethany,
All right, Bethany, how old are you?
18.
Okay, can you tell me what happened today?
Yes, I was riding on my dirt bike and I was going about 35 miles per hour and I accidentally fell off and hurt my arm, I guess.
Okay, well, can you tell me where you are?
My house.
Okay, and can you tell me what time of day it is?
About 6 p.m.
All right. I will determine the level of responsiveness based on the AVPU scale and state it. Bethany is A and O times 4. Can you tell me where you hurt?
My forearm bone and I guess my elbow.
Okay. I will identify and address any life threats. I will assess the airway for patency, noting any gurgling, snoring, or stridor. The airway is clear. I will provide BLS maneuvers and or airway adjuncts as appropriate. I will determine if respirations are adequate or inadequate. If a person is experiencing shortness of breath, I will auscultate lung sounds. Patient is experiencing adequate respirations. I will initiate oxygen therapy if necessary. I will now assess for a pulse, stating rate, strength, and rhythm. She has a pulse of approximately 60 beats per minute, strong and regular. I will now assess the skin for color, temperature, and moisture. She is pink, warm, and dry. I will assess for and control any severe bleeding. I will cover the patient with a blanket after I've placed her in a position that's appropriate for shock management. And I will assure that there is no severe bleeding. Then I will determine patient priority, low or high, and based on the GCS. I will, if patient is on high priority, I will prepare her for immediate transport and initiate immediate transport. At this point, I will obtain baseline vitals of blood pressure, pulse, and respiration. Skin signs and lung sounds have already been noted, and pupils will be examined during secondary assessment. I will verbalize the management of any priority injuries that have not already been addressed. And I'll obtain a sample history from the patient, or if patient is unresponsive, from a family member or bystander.